Hi, I'm Richard Gallagher. I'm here at Bankwest Stadium for the Parramatta Eels versus the Warriors game, and we've got a free pop-up here where you can have your mouth examined and your neck felt to see if there's any evidence of having a problem called head and neck cancer. So that's an important cause of cancer that's around the world. It's related to smoking and sometimes related to drinking too much alcohol. And more importantly, there's also a virus called the human papilloma virus that can cause the problem. It's pretty easy to have a look at people. You just need to look in their mouth and have a feel of their neck, see if we can feel any lumps in their neck. And this is all part of today, which is 27th of July, which is World Head and Neck Cancer Day. And over the past week, all around Australia and all around the world, different doctors and teams of people, speech therapists, nurses have been doing examinations of patients to see if they can see if there's any evidence of any problems in their mouths or their neck that might suggest that they have cancer. All right. Well, one of the reasons that we're doing this today is because the symptoms of head and neck cancer can be pretty hard to work out and people aren't sure of them. We wanted to bring screening out here to the people rather than expecting people to go to their GP or to turn up to the hospital so they can be looked at here. And I think it's really important to try and bring what we do and spread the word about what head and neck cancers are and what the symptoms might be by bringing ourselves out here to the people and meet you and perform free examinations and maybe alert the public to what might be significant problems. Right. Well, I'm here with Tim and I'm going to examine him to see if he's got any signs of any problems in his head and neck. Head and neck cancer is the 7th most common group of cancers that we see, and the problem is that they're all grouped together, but we're actually talking about cancers of different areas in the head and neck. So cancers of the mouth, cancers of the lip, cancers at the back of the nose or of the nose, cancers of the throat, cancers of the voice box, even cancers of things called the salivary glands, which give you saliva in your mouth. So when we sort of see someone like Tim and we're going to examine them, we have a feel of their neck first, because they might have a neck lump. So if you have a neck lump that you don't know why it's there, you need to get your GP or someone to have a look at it and see. And then we're going to have a look in his mouth and see if we can see any evidence of problems. So with Tim, I asked him before, if he's got any sore areas in his mouth, like an ulcer that hasn't got better, whether he's got any lumps in his neck, and whether he's had any change in his voice or he's having any problems swallowing or it's sore to swallow. And sometimes people get things like earache that's unexplained. And it can be, if it's in association with other symptoms like a sore throat or difficulty swallowing, that makes us get more worried that they could in fact have a cancer in their throat somewhere. So I'm going to have a look at Tim's neck now. So we're just going to have a look from the front and have a feel in here. Just having a feel. And what I'm doing is I'm feeling for lumps in what are called the lymph nodes in the neck. And they live around down this muscle here. So I'm having it's like he's having a massage, but we just have a feel under here, and I can't feel any lumps, so that's good. So we're going to have a look in Tim's mouth now. Okay, so just poke your tongue out, move it side to side. Good, back in. Okay, now open up and just breathe through the mouth. Good, beautiful. Just give me an Okay, so you can see his tonsils back there. We'll just have a look around his gums, around here. This doesn't really hurt. It's a little bit uncomfortable just to lift up the lips and things, but it doesn't really hurt. And then I'm just going to get a bit of gauze here, and then we're going to have a look down the side of Tim's tongue, make sure that there's nothing going on in there. Just poke your tongue out. Great. So, all right, so that looks good, and we'll just have a look over this side, and that all looks healthy as well. So, no, that's great. So Tim, you're in good nick.
Thank you, Richard.
No problems.
Really appreciate it. The screen today. Very happy.
Hi, I'm Julia McLean, the President of the Australian-New Zealand Head and Neck Cancer Society, and we're delighted to be here today with Throatscope and St Vincent's Hospital Sydney to provide free head and neck screening on World Head and Neck Cancer Day. So the Australian-New Zealand Head and Neck Cancer Society is a multidisciplinary society. We started in 1998. Our aims are to educate people about head and neck cancer and also to reduce the incidence and prevalence of head and neck cancer across Australia and New Zealand. This is our 5th World Head and Neck Cancer Day. It started in New York in 2014 when Michael Douglas teamed up with Jatin Shah from the International Federation of Head and Neck Oncologic Societies and proclaimed July 27th as World Head and Neck Cancer Day.
Okay, we've been running our free screening here today since about 11:30, and we've been screening people for head and neck cancer. So we've been looking in their mouths and we've been feeling their necks to see if we can find any abnormalities. We're just coming up to 100 people examined, and out of those 100 people examined, there's been 4 people who've had something wrong. So we've had somebody who's had a lump in their neck that we've said they need to go and see their GP. We've had somebody with something on their lip. And we've also had a couple of people who've had things inside their mouth. Now the good news is that none of these are sinister things, but they all need to be looked after and looked at to make sure that they're okay. So we're almost coming up to game time, but I hope that we're going to get a few more people through and have a look at them and clear them of having any problems.